Okay, so what is blood pressure? Essentially, blood pressure is the force that our blood has against the walls of our blood vessels, namely the arteries, which are the main blood vessels in our body. So the force that is applied by the blood onto the arteries, that is what the blood pressure is. Next slide, please, Hanif. So blood pressure, as we all may have seen when we've had our blood pressure checked or maybe seen it on TV, is essentially formulated from two different numbers. Hopefully once we get the slide up, I think we're on slide 4, Penny. Yeah, that's the one. So whilst we're waiting for the slides to come out, here we go. So blood pressure is it consists of two different numbers. So if you have a little look at the machine on the top left, you can see the two numbers, 115 and then 78. So the 115 is what we call systolic pressure. And that's the pressure within our blood vessels when the heart is pumped. So if you imagine our heart is a big muscle, so when it contracts and beats and pushes the blood around our body, that systolic pressure is that higher number. And then once the heart muscle relaxes, so in between the beating of the heart, it relaxes, and that's what gives us our lower number, which is called the diastolic pressure. So that's why we have two numbers. So in this example on the left, it's 115 over 78. Systolic is the pressure, the higher pressure, and diastolic is the lower pressure. Now, often on the blood pressure monitors, there's a third number, which is just our heart rate. So we can ignore that one for now. That's not relevant to the blood pressure specifically. Um, Now, blood pressure fluctuates minute to minute, hour to hour, day to day. If we're up and about, walking or exercising, our blood pressure is likely to go higher. But if we're resting, sat down, lying down, sleeping, it's likely to be lower. Um, but what we're, as sort of medical doctors, what we're interested in is your sort of average blood pressure. So what your blood pressure is doing over a period of time. And if that blood pressure is high over a period of time, that's when it starts to cause problems. So on the right-hand side of the screen, it gives us some numbers here of what we're interested in terms of what's normal, what's high, and what's low. So that green number there, 120 over 80, that's a perfect blood pressure. That's what we would love to see all of our patients having, 120 over 80. That's a completely normal and healthy blood pressure. If it gets too low, and that's quite rare, but usually if you're very sort of dehydrated or you've had some form of blood loss, it can go quite low, and that's 90, below 90 over 60 is what we call a low blood pressure. And unfortunately, when it gets to that sort of stage, people might start to feel lightheaded or dizzy and start falling over. But that's quite rare. What we tend to see more commonly in our patients, in our population, is a high blood pressure. And the significant number for us to remember is the orange numbers, so 140 over 90. So if your blood pressure is consistently above this number, 140 over 90, that's what we call high blood pressure, otherwise known as hypertension. That's the medical term. Hypertension is a consistently high blood pressure. Now, the thing about blood pressure is we don't feel it when our blood pressure is high. We don't feel it, and that's why it's quite a dangerous condition. It's known as a silent killer. We won't know that our blood pressure is high unless we check it on a reading on a monitor like the one in the picture shown. So that's why we'll talk a little bit about how we can go about measuring it in a while. But those red numbers at the top are also quite important to sort of be aware of. If it gets above 180 over 120, we'll be worried, and that's when really on that same day you need to talk to a doctor or 111. Next slide, please, Hanif. So how can we monitor our blood pressure? Well, I think it's really important for all of us to have a blood pressure monitor at home. They're really easily accessible these days from the supermarkets, from your local pharmacy, even online. They're relatively cheap. And actually you can share them amongst family. So you don't everyone, everyone in the family doesn't need one each. If you've got one to share amongst yourselves, that would be, really, really useful. How do we actually check our blood pressure? Well, we want you to be rested. We want you to be relaxed, ideally for a few minutes before checking your blood pressure. Try and use the same arm every time so that we get nice consistent readings. And don't just rely on one reading. Try and take two readings consecutively. So if you take one reading, maybe wait 1 or 2 minutes and then take a second reading. Again, just to increase the reliability of the numbers that you're getting. Similarly, some simple tricks. Make sure you're wearing loose clothing. If you've got really tight clothes on, that can affect your blood pressure. So make sure you've got nice loose clothing. Make sure you're sat down and your arm, like in the picture, is rested on a table or a cushion just to, take the pressure off that arm. And as mentioned before, we're not particularly interested in just one reading because, one reading doesn't give us that much information. The best way to check your blood pressure and get a really nice, accurate reading is to do it over 7 days. So if you want to do two in the morning, 1 minute apart, two in the evening, 1 minute apart, and do that for 7 days in a row. If you write them all down on a piece of paper, if you're able to, then work out the average, and that's the important number. But if you're not able to work out the average or you're not quite sure, then taking that piece of paper to your doctors, to your local pharmacy, they should be able to help. And it's really that average reading which interests us in telling me or your doctor if your blood pressure's high, if it's normal, or if it's somewhere on the borderline. Next slide, please. So now that we know what blood pressure is and how to keep an eye on it, it's useful for us to all know actually what causes us to have a high blood pressure. So there are a number of different factors, and the reality is it's not going to be just one of these. It's likely to be what we say multifactorial, so an addition of different risk factors that all come together. So being overweight, having too much fat particularly around the stomach area, is important risk factor. Having a high salt diet, that's really, really important in causing high blood pressure. If we have too much salt, then what happens is our blood vessels tend to draw extra water into the blood, and that increases the pressure in the system. Not exercising, smoking, drinking alcohol, drinking too much caffeine. These are all other contributors to raising our blood pressure, and also stress as well. Now, all of those things that I've mentioned are things that we can control. We can control how much salt we eat. We can control whether we smoke or not. But there are things also that are out of our control. So as we get older, our blood pressure tends to increase. As Unfortunately, as males, we tend to have higher blood pressures. Unfortunately, we can't do much about that. Ethnicity wise, if we are South Asian, as many of us are, or Afro-Caribbean, then again, our blood pressures tend to be higher. And then also genetics, so family history. So if your mom or dad or grandparents had high blood pressure, then the likelihood is that you're going to be at higher risk as well. So those things are, unfortunately out of our control. But if we know that we're at higher risk, then we can try and do things to control it maybe a bit better. Next slide, please. So knowing about blood pressure and what it means probably actually is all meaningless unless we know what the risks are of having a high blood pressure. And the risks are significant, and really it can't be understated. Having high blood pressure, and I'm not talking about having high blood pressure for maybe a day or a week, but the cumulative effect over many months or many years leads to damage uh, in our blood vessels. So if you imagine the system is under stress, it's under strain, all of that pressure is leading to damage in our blood vessels. And every major organ within our body has blood vessels. So I've written down here some of the key ones. So heart attacks and heart disease is, a really big sort of risk which high blood pressure can lead to. So if you imagine the blood vessels are being damaged, and damaged blood vessels, the sort of fatty deposits and cholesterol likes to gather where there's damage and deposits where there's damages, and that can cause blockages, and that's what leads to heart attacks. Similarly, with strokes, if your blood vessels supplying your brain are damaged and getting blocked, that's what leads to strokes as well. And heart attacks and strokes are two of the most, the highest causes of mortality across the world. But not only that, if people have heart attacks or have strokes, then, unfortunately, it can also lead to quite significant disability and illness. Strokes in particular can cause you to become blind. It can cause you to lose your speech, and it can, cause you to lose function of your arms and your legs. So really significant illnesses. Similarly, your kidneys are very much, affected by blood pressure. So the strain of blood pressure can affect your kidneys, lead to kidney disease. And I've added maybe one that's not so well known, but there's a type of dementia called vascular dementia. So as we get older, we can lose our memory and cognition again due to blood pressure, or uncontrolled blood pressure, I should say. So all of these things, are risk factors, are risks of having high blood pressure over many months or many years. And that's why it's really important that we're aware of it and try and get it under control. So what can we do? So as mentioned earlier, those sort of risk factors in terms of your salt, your diet, your exercise, all of those things we can all try and modify to try and reduce our risk of having a high blood pressure. So I've written down the key ones, the ones that we should all focus on. So reducing your salt. Now, the recommended limit of salt is 5 grams per day, which is 1 teaspoon, not a heaped teaspoon, but a level teaspoon. So actually not very much at all. And if there's one thing that we can all do quite easily, I would have thought, is try and reduce the amount of salt you add to your food and your cooking. If we're someone who enjoys going out to eat, going to have takeaways or going to restaurants. Unfortunately, it then becomes a little bit out of our control because we just don't know how much salt they're adding to their food. And the likelihood is they are probably putting quite a lot in it to make it taste good. So obviously trying to reduce the amounts that you have takeaway food and go to restaurants is a part of it as well. Exercising, really important. The recommendation is 30 minutes a day for 5 days in a week. So that adds up to about, 2.5 hours of exercise a week. It possibly is quite a lot for most people, with people who have very busy lives, working full time, family full time. It's very, very difficult. But, even if you can achieve maybe just a portion of that, just to keep your body active, even if it's just twice a week, once a week, that is better than nothing. And we live in a obviously technological age. We've all obviously got access to computers. We're all here tonight. So going on to something like YouTube, typing in home workouts, we can all be doing some form of exercise from the comfort of our own home. And that all obviously leads to maintaining a healthy weight, which is the next bullet point there. And then stopping smoking or reducing smoking, again, really, really important, not just for blood pressure, but for overall heart disease, overall health, the health of your lungs, etc. Again, really, really important. So these four things, if we can try and at least have some ambition to achieve some of these things, we know that it will have a beneficial impact on your blood pressure control. Doesn't mean you have to achieve the absolute maximum here, but if you can try and start to look at these things, reducing salt, doing a bit of exercise. If you smoke, try and cut down or stop. We know that your blood pressure is going to be a lot better, and then hopefully reduce the chances of having heart attacks and strokes in the future. I've added medication on there because obviously that's something from a doctor's side that we can do to help you control your blood pressure if it is indeed high. Next slide, please. And that leads me to obviously say, actually, if you are checking your blood pressures at home, what do you do about it? If it is on the high side. So I've done a little flow chart, modified flow chart. So if you're checking your blood pressures at home and it's normal, so as I said, below 140 over 80, then we're happy. Don't need to do very much. And we don't expect you to keep checking your blood pressure every day or every week. It's okay to check it maybe just every 6 months. And that's why I said, if you've just got one blood pressure machine at home, you can share it amongst friends and family because, if you've got a normal blood pressure, then you only need to do it maybe every 6 months or so. And it's a good idea, like I mentioned, to do 7 days worth of readings every 6 months just to keep an eye on it. But, if your readings are above 140 over 80, consistently over 140 over 80, then you might have what we call hypertension or high blood pressure. And that's when to go and see your doctor or your pharmacist. Show them your readings. They can obviously confirm or say otherwise that your blood pressure is high. And the likelihood is you'll then need to have some form of treatment to help you keep it under control. And then on the very far right, I've just written that sort of, the worrying sign, which is when it's really high, above 170, 180. If that's happening, you need to call someone on the same day. If you can't get through to your GP, then just call 111. But I've also written here that if you've got a very high blood pressure and you're having headaches, chest pain, or any form of change to your vision, then actually you need to call 999 or head straight down to the emergency department because that's a worrying sign. Very, very rare, but it's worth us all knowing about, because on the odd occasion it can happen, and it's definitely worth knowing about. But really, the sort of the middle column is the important one to know about. It's that 140/80 number. If it's higher than that, that's when to start contacting your GP. So I think that's everything from my slides and my information. But I'm happy to take any questions. Thank you, everyone.